Some couples who walk through this don't come out on the other side together. The asymmetry can become the wedge that opens up an affair or the breaking point for a marriage that had already been quietly drifting for years. On today's round, we're talking about something that doesn't get nearly enough attention in midlife medicine. We're talking about what happens when one partner in a marriage gets testosterone replacement therapy and the other one doesn't. It shows up in two main directions in my clinic, and it can quietly rewrite a marriage, for better and sometimes not. Today, we're going to talk honestly about what happens, why it happens, what nobody tells couples beforehand, and what you should be doing about it before treatment starts. Not after, if you can help it. Welcome to Playing for Life, the podcast where golf, hormones, and midlife performance are finally in the same conversation. I'm Dr. Amy Garza, a midlife hormone expert, aspiring competitive golfer, and someone who believes better performance starts from the inside out. On this show, we connect what's happening in your body to how you show up on and off the course. It's about building a body that lets you live better, play better, and stay in the game longer. Because midlife's not where you stop playing, it's where you learn how to play for life. Let's tee it up. If you've been listening to previous episodes, you know we spent serious time on testosterone, what it actually does in the body, why it matters for both men and women, and why it affects so much more than libido. Energy, mood, muscle, bone, brain, recovery, drive, and confidence, all of that. Today, we're zooming in on one specific situation that I see in my clinic over and over again. What happens to a relationship when only one partner gets treated? Before we go deeper, I want to address something that always comes up when we talk about testosterone in women. And I want to be honest about how I think about science and clinical practice and where I stand. There are research studies on testosterone in women, and they matter. I take them seriously. The Global Consensus Position Statement on Testosterone Use in Women is one of the most cited documents in this space. What it says essentially is this. Physiologic dose testosterone in women hasn't been shown in the studies to clinically significantly improve bone mineral density, lean body mass, body fat, or muscle strength. The studies also don't strongly support testosterone for cognitive performance or general well-being in postmenopausal women. The one indication that is considered evidence-based for testosterone use in women is treating hypoactive sexual desire disorder. It's just a formal term for low libido with no other identifiable cause. I want you to know all that because if you go looking, that's what you're going to find on paper. But there's another really important side to this. I've been prescribing testosterone to women for more than a decade and taking it myself even longer. I'm immersed in hormone management every single day. This is my practice, not a side gig, not something I do alongside other related specialties. And what I see patient after patient, year after year, is something the published studies haven't yet fully captured. I'm watching bone density improve, muscle hold on, energy come back, brain sharpen, and vitality return in ways that aren't subtle. I can't hand you a peer-reviewed paper for every claim I'm about to make in this episode. That's the honest truth. But the literature is one piece of the picture, and the lived clinical experience of doctors who are actively practicing in this space is a different one. Both matter. And anyone who tells you the two always have to perfectly agree is either not reading the studies carefully or not seeing patients in real time. So, as I talk about testosterone today, keep that frame in mind. When the studies say something definitive, I'll tell you. When I'm speaking from clinical experience that the data hasn't fully caught up to yet, I'll tell you that too. And a quick note, before we get into it, I'm a doctor, but I'm not your doctor. This is education only. Use it to have a better conversation with your own doctor and with your spouse. Okay, let me start with a conversation I have in my clinic with every single patient who walks in asking about testosterone. We find out if they are partnered. And before we ever make a treatment decision, before we ever write a prescription, we talk about libido and vitality in that relationship. Now, I want to be really clear. Testosterone is not just about libido. We've talked about this before. It affects your bones, your brain, your muscle, your energy, mood, confidence, and your motivation. So much of what makes you feel like yourself in midlife is downstream of having healthy testosterone in your body. But libido is one of the things testosterone affects. And depending on where you are with your partner before treatment starts, that effect can land in very different ways. Let me give you the scenario I see most often. A couple arrives in midlife, and over the last few years, the rhythm of their sex life has quietly slowed down. Maybe they're having sex once or twice a month, maybe less. Neither one is really initiating, neither one is missing it that much. They're not unhappy with each other. They're just in a season where sex isn't high on either of their lists. It's quiet and it works for them. And then one of them gets put on testosterone and the other one doesn't. And here's where things get interesting. The treated partner starts to feel like themselves again. They have more energy. Maybe they're sleeping better. Their mood is steadier. They're starting to lose some of the weight that wouldn't budge, or they're noticing their spouse in ways they haven't in years. And yes, their libido comes back online, sometimes pretty sharply. The untreated partner, though, is still right where they were. Same lower drive, same not missing it mindset. And now, all of a sudden, the treated partner is showing up with the ask on the regular. Sex suddenly is a great idea again, at least for one of them. And quickly, it turns personal. We just create a problem that didn't exist a couple months ago. This cuts both directions, and I want to be really clear about that. The conversation usually focuses on men getting TRT, but I see this just as often with women on testosterone whose husbands are not being treated. She's feeling like herself again, her drive is back, and her husband is dealing with his own things. Maybe erectile issues, maybe low T he's never had checked. Maybe he's just exhausted from work and life. So now she wants sex and he doesn't. The asymmetry is the same. The strain on the marriage looks the same. People start taking it personally. What I have come to understand over the years is that when this asymmetry shows up, this mismatched libido, both partners start telling themselves stories. And those stories are often where the real damage happens. The treated partner starts wondering things like, am I even attracted to my spouse anymore? Why don't they want this when I do? Have we just grown apart and I just couldn't see it before? Was something always off between us? The untreated partner is often spiraling in a completely different story. Why is my spouse so different all of a sudden? Is something wrong with me? Are they really happy with me? Do I even know this person? What if they go somewhere else to get what I couldn't care less about? Some of those stories may have truth in them. A lot of them don't. But once they take root, they're hard to dislodge, especially when nobody is saying any of it out loud. This is where I see marriages start to wobble. I want to name something here because I think being honest with you matters more than making you comfortable. Some couples who walk through this don't come out on the other side together. The asymmetry can become the wedge that opens up an affair, the reason a spouse files for divorce, or the breaking point for a marriage that had already been quietly drifting for years. The new energy and desire of the treated partner doesn't always land softly. I'm not telling you this to scare you. I'm telling you because I've seen it. And what I've learned over more than a decade of doing this is that the couples who navigate it well are the ones who started talking at it before treatment ever began. The couples who got blindsided are the ones who walked into hormone replacement thinking of it simply as a personal medical decision. And in a marriage, almost no medical decision is fully one-sided personal. So here's what I want every couple to understand. If one of you is considering testosterone replacement or any hormone replacement, honestly, the conversation about libido, connection, and what's happening in the marriage has to happen first, not after. Both of you together, ideally with the doctor who's prescribing the medication. And listen, if you haven't had it and you're already taking this, now is as good a time as any to have this conversation. And if your spouse is the one being treated and you're not, you deserve to know what's likely to change. Their libido may come back. The dynamic between the two of you may shift. And you should be getting your own health evaluated at the same time because there's a real chance you would benefit from treatment too. Nobody may have even offered it to you. It's one of the patterns that breaks my heart in my practice. The husband gets TRT, feels great, and his wife is sitting in untreated perimenopause, feeling worse by the week. Her sleep is broken, her patience is gone, her anxiety is up, her own libido is somewhere in another zip code. The weight isn't budging no matter what she does. And now her husband is full of energy, wants to play golf every weekend, have sex every night, and she feels like the problem is in the marriage. She might even feel like he doesn't love her anymore, at least not like that. She is not the problem. The system is the problem. Nobody offered her care. She was told her labs were fine, or even worse, nobody asked how she was doing. They just treated him. Listen, the same thing happens in reverse. If you're a woman on testosterone and your husband is sitting with undiagnosed low T, untreated sleep apnea, depression he's never named, or a heavier weight that's affecting how he feels in his own body, he deserves care too. You can't drag him to the doctor, but you can advocate for him to at least be evaluated. Now, I want to spend a few minutes on something I didn't fully get into on the testosterone episode for women, because I think it's important and I think it really matters in this couple's conversation. Women on testosterone replacement generally don't feel constant, spontaneous, everyday sexual desire like a man on testosterone might. I know that probably surprises some of you. The way most women's desire actually works, though, even with healthy testosterone levels, is more reactive than spontaneous. Meaning, desire tends to show up in a response to context, connection, the right environment, not as a constant background hum that demands attention all day. So if you're on testosterone, women, and you're feeling that constant spontaneous urge, thinking about sex all day, initiating multiple times a week, feeling kind of ramped up about it, your husband might be happy about it in the short term, but I want to gently tell you what I tell my patients. That's often a sign that your dose is too high. And here's why that matters. Having done this for over a decade, what I consistently see is that intense response doesn't last forever. You may get a few years of feeling that way, and then over time, the dose stops giving you the same return. Meanwhile, you've been pushing your levels higher and higher, which exposes you to side effects you generally don't want as a woman. The kind of side effects that start to move you in a more masculine direction physically. Not a trade I want my patients to make. Again, like many things stated in this episode that I've experienced in clinical practice, this pattern of diminishing response isn't something you'll find documented fully in published studies yet. It's something I and other clinicians in this space observe in practice, and it's one of the reasons I'm cautious about dosing. So, the principles I practice by is the lowest possible effective dose. Enough testosterone to give you what you actually want from it, your energy back, your bones strong, your brain sharp, your muscles maintained, your vitality returning, and a healthy, reasonable libido, without pushing you into a territory where you start to become someone you don't recognize. This is why symptoms in labs should always be looked at in concert. Now, let me bring this back to the couples conversation because there's a specific scenario I want to make sure I cover. If I'm treating a woman whose husband is having his own issues, erectile difficulties, low drive, something not yet diagnosed, I'm still going to give her the opportunity to experience the benefits we're aiming for with testosterone. And while the strongest evidence supports the libido piece, in my clinical experience, many women also notice improvements in energy, vitality, that the studies haven't fully captured yet. I know this greatly improves her chances of feeling like herself again. That being said, we're going to set expectations together about what success looks like. Libido is not going to be the primary marker of whether her treatment is working, because if it ramps up sharply and her husband can't meet it, we've just made her situation harder, not easier. We've added a layer of frustration on top of an already complicated situation. Same conversation in reverse for a man whose wife is dealing with her own untreated stuff. The treatment is for the patient, but the marker for success has to fit the patient's actual life, including the marriage they're actually in. Okay, let me wrap this up with what I want every couple listening to take from today. If one of you is thinking about hormone replacement of any kind, both of you need to be part of the conversation, not just informed after the fact. Engage from the beginning. Get evaluated together when it makes sense. And don't let one of you race ahead while the other is still suffering in silence on the other side of the bed. If you're already living the harder version of this, where the asymmetry has already shown up between you, where one of you is treated and one of you isn't, and things have started to feel very different, please don't dismiss what you're feeling. The shift is real. The stories you're telling yourselves are real, even if some of them aren't accurate. The way through is talking with each other honestly and getting the untreated partner evaluated. Not necessarily treated, just looked at by someone who actually knows what to look for. And if you're in the hardest version of this, where the asymmetry has already opened a real fracture in your marriage, I'm sorry, you're not alone. You're not weak. You didn't do anything wrong by paying attention to what was changing. This is what midlife medicine done unevenly can do, and most couples were never warned it was even a possibility. Here's what I really want you to take with you. Hormones change marriages. It's not a bug in the system. It's a feature of how powerful these treatments actually are. Use that knowledge to your benefit. Don't go into hormone replacement without the conversation. And don't accept being the untreated partner just because your spouse went first. You deserve to feel like yourself too. This is why at AgeWell, I love taking care of couples so much. It is so fun to see couples reignite their marriage after years of some kind of discomfort or boredom from not feeling like themselves. Sometimes it starts with one and then the other, but often it starts together, and it's so much fun. If something in today's episode hit the sweet spot, do me a favor. Follow the show so you don't miss what's next, and share it with a couple who may be living through this without knowing what to call it. Drop a comment and tell me what landed, or if you've seen this in your circle. Remember, you can always ask questions privately by going to amygarzamd.com/podcast. I review all the questions and will touch on them in future episodes. Your questions shape where the show goes next. Until the next round, this is Playing for Life. Here's to living better and playing longer.